Can you guys introduce mommy?
Spill the beans with Dr. Jill.
Hi, everyone. Thank you so much for joining on today's episode of Spill the Beans with Dr. Jill. As always, I would like my guests to introduce themselves.
My name is Sarah Sparren. I'm a registered nurse specializing in hospice and palliative care, and I'm also the founder of a death education company called End with Ease.
Thank you, Sarah. How long have you been in school for your credentials? Ballpark.
Hmm. Ballpark?
Yeah,
Like, how long did it take me to get my nursing and my bachelor's degree?
yeah, all of it.
No, okay. So I did everything at my own pace. I didn't go back to school till my early 30s. So it took me 5 years to finish an associate's in nursing as a single mom, 2 years of clinical time, 3 years of doing the prerequisites. What most people don't know about nursing is if you get an associate's, you also have to have an associate's in like science or general studies before you do the 2 years of clinical time. So that was a 4 year that turned into a five. And then I took my time in my bachelor's, and that took me another 3 years. So a total of 8 to be where I am right now, and a few master's classes that have thrown me for a loop.
That's amazing. And this is so great because this season is dedicated to the medical profession. And you were referred by a friend of mine who was like, You've got to talk to Sarah because this is exactly what she knows a lot of experience about. My question to you is, in your academic program, did you take a class or did a professor ever talk to you and use the words vicarious trauma?
Never.
Ugh. Is that shocking to you now that you've lived the experience?
The reason I have my business is because I cannot even believe the things that were missed in nursing school and even like training as a nurse in a hospital and in the community. Never.
And we're not, we're not saying that the academic programs aren't good and they're not
No.
quality, but I am suggesting that the helper is not the focus and that we need to talk more about what is going on in the medical profession and the other helping professions to sustain the helper. So,
Mhm.
what have you learned that you would want us to know about vicarious trauma, especially someone that might be going into your field or is
Hmm.
feeling it? What kind of information have you learned?
That I am responsible for my own healing, which is across the board. So, what I've explained a lot to people who are in my life when asked how I do this, how I do death work overall, is I am constantly investing in myself. It costs me a lot of time and money between
Yeah.
counseling and cacao ceremonies, kava ceremonies, women's campouts, breath work, yoga, meditation. Like I am constantly in mediation, like to try to like maintain mental homeostasis so that I can continue to serve. So I can
Right.
continue to be a caregiver because that's what lights me up. And kind of checking my own pressure gauge to see where I'm at and how much I need to release. And
Mhm.
um, when you're in it, as someone in service to other humans, it's important to self regulate. But my experience has not been one where any place that I have worked has had really good, consistent, adequate supports for staff.
It's so interesting. I appreciate that you framed it as death work because I don't know that I would use that vocab and I don't know if that would be offensive terminology. So I appreciate that you're kind of teaching us that. But also, one of the things with the other practitioners that I've met with this season, they say that they kind of get rejuvenated when their patient, their client gets better. That
Mm,
that doesn't exist for you.
no.
Can you talk a
Uh,
little bit about that?
Yeah, I mean, my work is a bit different. My day is complete when someone has had a good death,
Mm.
or I am able to guide them onto hospice, and they are able to be at peace and say thank you, or I trust you, or I'm ready because I have given them information. My goal is to empower them enough to trust their own bodies and their own process so they're not dependent, reliant spiritually, physically on
Mhm.
anyone to do that. So my work is very different, where death is not a failure in my space. Death is the goal, but a good death is the goal.
Right. Is there a movie or a song that you feel depicts what you experience in your work?
Mm, um, it's funny you say that because there is a podcast called Dying for Sex, and they did it on Hulu, and they like did it as a show. And
Mhm.
in one of the scenes, there's a hospice nurse that comes into the room that describes the dying process to the woman who has cancer, and it was the most clearly, properly depicted way of sharing that information that I've even ever heard from another clinician, like in the real world. Like I haven't heard other clinicians around me describe it in that same way. And that's how I do it. So it was the first time that I felt like seen, by a
Right.
movie or
Yeah.
depiction where I was like, oh, you did that right. Because usually
Mhm.
I'm picking things apart. Like
Right.
we're all watching The Pit and we're like, oh, we love The Pit. I love The Pit. But they had a woman that went in there with cancer and they hooked her up to a morphine drip and she died an hour later. That's not how it works.
Right. Yeah.
So
I think
most of the
Hollywood
time,
kind of
yeah,
speeded up for us. And I
yeah.
so I it's interesting to me because in that episode, I'm assuming though that the narrative was never about how that nurse was doing afterwards though, right?
Oh, and I think a lot of the story around The Pit is the fact that the all of them are struggling mentally and
Right.
drained
Yes.
and have their own stuff going on, right? But they're
Right.
still required to show up to work.
Mm-hmm.
And one of the stories there's two pivotal moments in my nursing career where I collapsed. And one was I was a nurse during COVID, and a year in I got diagnosed with cervical cancer. And when the doctor told me I had cervical cancer, I took the deepest exhale of relief because I thought, oh, thank God. Thank God I have cancer because I get to step back and like take care of myself for a minute. No one can make me do anything. I had the C word, right? No one could make me do anything. And the second time was shortly after when I went back to work into hospice work, and I had a young boy who died very, very uncomfortably, and it was extremely traumatic. And there was no follow up. There was no meeting after. There was no support for me. And when I reached out to my supervisors and I said, I can't eat, I can't sleep, I can't stop thinking about him, they told me to go to the hospital. And that was the support that I didn't go to the hospital, but I was desperate. I went found every Reiki person I could find, every medium, every therapist. I mean, it was all on me to try to recover from this. And it took me years to reframe and
Mm-hmm.
transmute that energy into something, which is eventually how I started my business. Was I took that grief and that energy from that significant pain that nobody helped me with, that there was no support for, there was no meeting, there was no anything. And I couldn't get rid of it. So I changed the energy into something that moved me forward.
I feel like that will be very inspirational for audience members to hear. Because a lot of the people that I have talked to feel like they're just drained and they're burnt out. And I try to say, this is a pendulum, right? Like compassion satisfaction's over here, burnout's over here. There's a whole myriad of areas that you can explore. And one of them is nurturing your vicarious trauma. And it
Mm.
sounds like you have learned a negative byproduct, but you've learned to take care of yourself in the ways to sustain in your field, right? What is the one thing that you do, either daily or a ritual, that really helps?
It's very cliche, but I started it 2,236 days ago, and I have a gratitude list. And every single morning I wake up and it's non-negotiable. The morning of my surgery, I did it. When I'm traveling, I do it. If there's any kind of emergency, it's in my bag and it doesn't get missed, because on the absolute worst days where I have not wanted to live, where I have not wanted to get out of bed,
Hmm.
I have sought for and looked and reviewed the day before to find beauty in the hardest of days. And as long as I can continue to do that, then I know I'm okay.
And those that are in the helping profession, but are also dealing with their own PTSD, their own grieving, their own personal trauma,
Mhm.
what advice or guidance do you have for that?
Mm. Explore everything, like explore anything that you might be resistant to. So, like, it took me 2 years, but I went to a somatic, huge, like, breath work thing
Mhm.
and had massive breakthroughs. And I'd never been about that at all. And now I'm in training because it's been so different. Like, I make sure I get in nature, I take my shoes off, like, back to basics. Also, are you eating? Are you
Mhm.
sleeping? Are you drinking? Like basic self-care stuff. If that's all you have the energy for,
Right.
then do it because I mean that saying that I'm sure you've heard 20 times in all these interviews is like you can't pour from an empty cup, and that's
Yeah.
true. Um, but this medical system, the way it is set up,
Hmm.
it's not designed to be sustainable for us or sometimes our patients. And a lot of the work that we're doing is not only advocating for ourselves, but advocating for them in a system that we're a part of.
Hmm. Hmm. It's so powerful to hear and the echoing and and the shared themes, right, of other practitioners who are saying, self-care and this is what that looks like for me. And you're saying, go outside your comfort zone and try something new because that is really how you learn your new passions. I was just talking to someone about hobbies and the value of a hobby. What do you do that is outside of work?
I run away from home. I
Ah,
pretend like I'm a little kid that got in my mom's car with all my food and toys, and I literally do that. I'm 48 years old, and I pack up the back of my car and I put a little Japanese mattress in the back, and I drive away for sometimes a week or two, and I sleep in my car and I explore mountains and I go to restaurants I've never been to, and I sit alone.
mm-hmm.
I sit alone. And what I find is that I always expect that I'm going to be met with a wall of grief. And instead, I'm always met with a wall of gratitude.
That's exciting. I did have one practitioner say, because of my credentials, I don't typically tell people what I do for a living because then they kind of trauma share. Um,
Yes.
does that happen
Yeah.
to you? Yeah.
Either people don't want to talk to me, they
Okay.
immediately get uncomfortable, or they immediately want to connect in their grief or their loss or their experience with death, which I'm always open to conversation, but I am also I acknowledge that I'm very susceptible to other people's emotions and feelings. So while I can hold space and be present, I have to, every time I do that, it's more work for me to go home and cleanse my own spirit, you know?
How can people stay connected with you? Is there a book, a website? What would be the best way for us to stay connected?
So and I am Good Death Nurse on Instagram. My business is called End with Ease, and it's at endwithease.org. I do lots of workshops where I'm teaching about the biological and scientific process of death so that people can really learn to trust their own bodies and what it does. And I also teach workshops on maneuvering the entire medical system, palliative, hospice, the whole medical model. So you can go on my Instagram and often see where there's upcoming workshops so that you can be empowered to live presently through the understanding and connection with death.
Thank you, Sarah. Before you go, I always ask my guests to spill the beans on vicarious trauma. It could be a quote, it could be a mantra. What
Mhm.
would you say and leave us with for your final thoughts?
I always say this, nothing is as terrifying as our imagining of it.
Mm,
So experience and learn. Don't just be afraid and not do things because you're afraid.
yeah. Thank you so much. Thank you, everyone, for watching today's episode. Until next time. Hi, everyone. Thank you for joining on today's episode of Spill the Beans with Dr. Jill. And it was a great session for me and good timing. I did take a reflective moment to kind of breathe and say some blessings. I recently had a colleague who passed away, and I didn't want this episode to be about me. And so Sarah brought a lot of great information that I would love us to focus on and not feel so sad because while death is very sad, these are people who experience this every day because that's their job. And so I want to kind of extrapolate those gems so that we can continue the conversation about managing our vicarious trauma. Something that she talked to me about after our recording was something I'm very familiar with. So, as a Title IX coordinator or someone in discrimination investigations world of sexual violence and harm, many people will say to me, Jill, I don't know how you do your job. And I say it's an honor, and I wouldn't want to do your job and have like that moment of levity. I said that to Sarah. I said, Sarah, I don't know how you do your job. And she said to me, it's an honor. And I found that to be just so sweet that she thinks of it. She says that not only does she get that moment to connect with the patient, mind and body and spirit, but she said that she has learned so much about herself. And we talk a lot about how, like, what we do for a living evolves and changes us with the amount of vicarious trauma that we receive. And I will say that she shared with me that she genuinely enjoys life and the moments within life because she is surrounded by death. And so I thought that that was also really beautiful. She manages her vicarious trauma with a bunch of self-care strategies. She also took some time off. She developed her program, her business. These are all best practices I feel can really help you and provide a different connection with someone who is aware of vicarious trauma because she's lived it, not because she was taught it, and is now able to have those conversations of what's working for her and what's not. For all of you in the helping professions, I hope that you know it's human to have these responses. And why I'm going to post this video, even though you saw me tearing up and getting emotional, is because I'm human and I am not perfect. And I want you to know that as well. So thank you for everything that you do. And thank you for watching today's episode.